Dr. Faulkner from Harry Medical College, and the issue is diabetes and kidney disease. And of course, Dr. Faulkner, let's give you an opportunity to talk about diabetes and perhaps give us what you might consider a checklist in terms of the impact and the effects that this disease has upon individuals.
Well, once you're diagnosed with diabetes, then there are several things that you must keep up with. One is your cholesterol. You should get it checked every year. Another is your eye exam. You should get that checked every year as well. Then as it relates to your blood sugar, your hemoglobin A1C, you should get that checked every 6 months. If it's not controlled, every 3 months until it's controlled. So there's several things you need to check on. You also need to check on your kidneys, and that's the main reason why I'm here, because your kidneys should be checked on every year as well.
And so the kidneys is very intimately associated with diabetes.
Oh, yes. Oh, yes. Diabetes affects every organ in your body, your brain, your heart, your kidneys. It just affects just about every organ in your body. If you don't check your diabetes and it gets out of control, then you start to lose protein in your urine. And once you start to lose protein in your urine, after about a 10-year period, you could end up on the dialysis machine or kidney machine.
And talk about the kidney machine or dialysis. What's the process in reference to that?
Well, dialysis is a form of renal replacement therapy. Renal means kidney. So it's a form of therapy that we can use to substitute your kidney. Of course, it is not 100% like a human kidney, but it maintains your lifespan, and it gives you an opportunity to wait on a kidney transplant.
Now, I understand that this is a very, very expensive proposition, these dialysis and whatever. Talk about that as a cost that might be associated with kidney disease.
Oh, yes. Dialysis is very expensive. It can cost from $35,000 to $50,000 a year per patient. And there are about 450,000 patients on dialysis across the United States, so it is a big part of what the government spends to take care of a patient who has kidney disease.
And anything that could be done in order to decrease the number of individuals who might be impacted by this disease will help not only individuals, but will help the national government and help the governments as well.
Oh, yes. Oh, yes. Anything that can be done. First of all, if you have diabetic kidney disease, what you need to do is make sure your blood pressure is controlled. Make sure your blood sugar stays under control. Make sure your lipids or your cholesterol stays under control. Those things can help you decrease your progression of kidney disease and increase your lifespan as well.
And so it's really an individual decision that can make all the difference in the world in terms of how they might be able to respond to the treatment. Is that it?
Oh, yes. Oh, yes. The better you respond to the treatment, the fewer doctor visits you have, the decrease in the cost of your care. It is amazing what can be done if the patient works along with the doctor to help treat the diabetes.
Well, what have you found in terms of dealing with patients to be some of the real reasons that people don't do what they're supposed to do as patients? I know that, you know, you see people every day and you've told them to do this or do that, and et cetera, but yet still they're not doing what they're supposed to do. What are some of the reasons that they give to you in reference to that?
Well, you know, a lot of the medications are expensive, and a lot of patients don't have insurance. And so that impacts what the patient does. Sometimes the patients don't understand